Thank you, Dr. Beatty, and welcome to everybody to this year's forum. As for some of you who may have been here last year, you know that we're a little bit late. We usually have this in January, but we've tried now to switch in the summer or the springtime so that weather will not be a factor in participating. Before we get started, I just want to make a couple of recognitions. First of all, I really want to say thank you to our sponsors who really let us put this public event on free of charge, in particular our relationship with the VGH and UBC Hospital Foundation and their relationship with RBC, who really sponsors this event for us. And for those of you who may be interested in participating in supporting research, Stephanie, who works for the VGH Foundation, is here, and please feel free to go to their booth and discuss further. So before we get started, I want to jog your minds a little bit. So we're going to do a little polling. So each of you may have, or you may not have, but most of you have one of these in front of you. Most of you do. So the first thing you have to do, if you have one of these, mine is blue, but yours is white. There's a little orange button at the top. Click on that once, and you'll see a green light come on, hopefully. Everyone get that? If you have one of these little older ones, it's at the bottom. So click at the very bottom once, and you'll see a blue light. Okay, let's see if we got this to work. So don't click it yet. So we are interested in knowing how you learned about the forum and whether you've been here before. So I'm just going to go through a few questions, and then we can get a sense of whether you have or have not been here before. So let me just fix this here. So this is the first question. So don't click yet. Have you been to this forum in the past? So click A if you have, and B if you have not. Oh, good. I have 90 people so far click. Let's see. All right, so about 50-50. So about 50% of you have not been here before. That's terrific. Still coming in. Don't change your answer. No. Okay, a few more questions. So, how did you learn about this year's forum? This really helps us in understanding how we can best advertise this. So, click the appropriate response on your remote. Did you hear it from our clinic? Maybe you were visiting or had a clinic visit. Was it an advertisement? Were you on the Alzheimer Society website and saw this? Did you hear it from a friend or a family? Or was it something else? So pretty mixed. Still coming in a few responses, but I think that's good. Thank you. A few more questions. We're interested in knowing whether you currently have a relationship with our clinic or if you don't. So click A if you are a patient in the clinic, B if you're a family of someone who's being seen in the clinic, and click C if you're participating in research but you're not a clinic patient, so just for research purposes. And then finally, if you have no affiliation with the clinic, you just learned about this elsewhere, click D. Okay, very good. And the final question is, we would like to know what you want to learn. So obviously we've created a program for you this year, so you don't have much of a choice. But we certainly want to know what you might want to learn in future fora. So here are some options. You can't see the letters here. Let's see. Oh, there you are. So A, if you want to learn about new developments in drugs and new therapies for Alzheimer's disease. I should have changed the spelling. Someone told me this before. I'm going to do it now. B, if you want to learn about the basic science research or laboratory research that relates to dementia. C, if you want to just learn more about dementia in general, maybe more general information and about different conditions. D, if you want to learn about what you can do now for lifestyle and coping strategies. And finally, E, if you come to this event mainly to network with other people or maybe with the medical community at UBC. So we have almost everybody. Let's see. Very good. That was great. Thank you for participating. This really helps us to learn about what we should do for other years, and it also wakes you up a little bit so we can get going. So I'm going to give you a brief snapshot. Every year in the last 2 or 3 years, I've talked about some clinical trials. So for the 50% of you that have been here before, you've probably seen some of these slides in the past. So what we really want to do is every year give you an update on the same trials, because sometimes they finish and sometimes they're continuing, and we want you to understand when we expect results and what those results mean. So the field is still struggling, if you will, or trying to understand the basic pathology in Alzheimer's disease, and hopefully you've seen some of these slides before. We've known now for at least 100 years that if you look in the brain of someone with Alzheimer's, you see two, although there are many more, but two principal pathologies. One is a plaque on the left side of your screen there, also known as amyloid or A-beta, which you may have heard of. And the other one on the right is a tangle, which contains tau, also called the neurofibrillary tangle. So the focus so far has been mostly on the left side, on the amyloid or the plaque, and the sort of new innovation in diagnostics is that we can now image someone's brain with something called a PET scan, and you can actually detect these deposits in the brain in a living person. So we've made great strides in diagnostics. I think we are quite good at diagnosing Alzheimer's disease. We're quite good at diagnosing that there is amyloid in the brain. But the question, of course, from a research standpoint is, can you remove this plaque, remove the amyloid as a therapy? And that's really been the main question in research in the last 10 or 20 years. And we have learned from imaging that over your lifetime, plaque builds up in the brain. It's not just when we reach maybe above 60 or 70. It actually probably begins in your 40s and 50s. But you don't get any symptoms until 20 or 30 years later. So for now, the research has focused on this latter part of this. So when you have symptoms, so we call that maybe the later part of the disease course, because it starts much earlier. But this is where the research has been focused. And you'll probably see over the next decade a switch more towards the earlier phase of this graph. But for now, the research that we're doing is focused mostly on the later stage of amyloid deposition, if you will, in the brain. So some of you may have heard about a recent trial that was published. This is Merck. Merck is a pharmaceutical company. They had a drug that I would challenge you to say that name 5 times really fast, very Besistat. It's a hard name, as with any drug. But what it does is it halts production of amyloid. So the body produces amyloid constantly. We all do. But this drug decreases that production. The problem with it is that it probably doesn't reduce the plaque that's already in the brain. It just decreases the new production of amyloid. And it was very successful at that. It looks like it reduced it almost completely. But unfortunately, at least in this stage, it was not effective, which certainly was a disappointment for many of us. And they also stopped the study. Just going back to this, they had a study in the mild phase or pre-symptomatic phase that they also stopped because it didn't look like it was going to have an impact. And it may be because there's already plaque buildup in the brain. So that's maybe the most significant news in terms of a big study that was published since the last year's forum. Some of you may remember this. This was on our brochure last year. This drug is called aducanumab, and it's made by a company called Biogen. And this is a PET scan of the brain. So the colored images here show amyloid in the brain of a living person. And if you take that drug at the highest dose for a year, the image on the right is actually the same person, but you can see now that the red color has really been decreased. So meaning that you've really been able to reduce amyloid plaque in the brain significantly over the course of a year. So the question, of course, is the same question as last year. This trial is still ongoing. If you accomplish this, does that translate into improved memory, for example, or improved cognitive symptoms? And we don't know that yet, but this trial is scheduled to end maybe next year or maybe a year later, but we'll have the answer to that then. And hopefully we will be able to report that at that year's forum. So again, there's a shift now towards earlier treatment. The problem is identifying those people that have no symptoms, 40-year-olds, 50-year-olds, and treating them with a drug that may not be completely harmless, and it's a real challenge. So more on that probably in the next few years, but that's really where I think the shift or the focus is shifting. And I kind of liken it to, I've said this before, sort of a colonoscopy. If we can identify a polyp early, you can prevent colon cancer. So we hope that this is what's going to happen with something like Alzheimer's disease too. You detect the changes early, there's a treatment that you can stop the progression, and thereby you prevent the disease later on. So I have a couple of more minutes. There's a couple of trials that were initiated here. And instead of removing amyloid in the brain, you can remove its toxicity. So this is one of my favorite slides in neuroscience, I think. So the arrows point to these single contact points between two nerve cells in the brain. That's really what makes us unique, is how these different contact points differ between one individual and another. If you add amyloid, which is in red there, that's the same, by the way, same neuron on top and the bottom. So you see the arrows, it's gone on the bottom. That's because you're adding this toxic amyloid. And we have a cancer drug that we repurposed to prevent that, called saracatinib, which you may have heard of last year. It was a one-year study. We actually just completed the study, and we'll be reporting this in July. So there will be a press release, but certainly next year we'll give you an update too about what happened with that. And then finally, this is a coconut oil study, just going back one. So in Alzheimer's disease, what that arrow is pointing to is how sugar is taken up in the brain. It turns out that sugar is not taken up well in the brain in someone with Alzheimer's disease. And one way to try to mitigate that is to, instead of feeding the brain sugar, you feed them something called ketones, which happens to be in coconut oil or some coconut oil derivatives. And we have an ongoing trial of this now. And then I'm going to conclude just many of us think that we have to maybe go back a little, to take a few steps back and see, do we really understand some of these basic mechanisms? And by doing that, we've also been able to develop new technology in terms of the scientific community. And we can now take your cells, this is from Jonathan Frew, a PhD student in my lab. You can take blood cells, we can take your blood cells, and we can reprogram those blood cells into a nerve cell, and thereby studying you, not someone else, not 100 people, but your brain we can model from your blood. It's really quite amazing. This is what it looks like after you take a blood cell and you reprogram them into nerve cells. And then you can ask very basic questions. Is someone with Alzheimer's disease, for example, are their nerve cells different on a fundamental level? Do they differ in the way they communicate with each other at the very beginning? And you can, for the first time, you can really study this with a patient's own cells. It's not someone else, it's not an animal, it's not a mouse, it's your cells, which is really, really fascinating. And this is, just to give you a sense, this is a person's blood cell reprogrammed to a nerve cell, and now you see how they're blinking? They're forming networks together. And now we're modeling an individual's disease, not a group disease, but an individual disease, which may be important. So thank you very much. We have a really exciting lineup today, I think. Very diverse, some research, some more social science, and some practical advice. I really hope you'll enjoy it. And I want to just finally just make one pitch. What we really ask you to do, there's a permission to contact form. We won't send you any spam, don't worry. But we really ask you to fill this out and leave it at where you're sitting when you're done with it. And this really gives us an opportunity to tell you about the events we're having and other opportunities. So thank you again.